Birx, we know that there is a lack of tests in this country and a lack of testing. Apparently, I think to date only about 1% of Americans have been tested for the coronavirus. Why is there such a lack of tests, and how can you make any recommendations really without all the data?
So we've been expanding testing at a logarithmic rate over the last 4 weeks. We've gone from about 20,000 a day to 120,000 a day. And I think every day we're expanding testing. Right now, we still have additional testing capacity in this country and tests available throughout the country. What we're trying to do right now is to match the platform with the test, with the outbreak, and with the states to work in a cooperative manner so that commercial laboratories or other hospitals that have openings to be able to do more tests will instantaneously be able to know who additionally needs to be tested. So bringing that data together in a new way.
So, Dr. Birx, I want to talk about something you said in the previous segment. I'm quoting you. You said, "I see how it can go from just a few cases to many cases." So my question is, how can the administration even think of opening up areas with just a few cases, if that's a fact? There are now 7 states that haven't issued any stay-at-home, rules. So how can you even enforce it, even if there are just a few cases that will go into more cases, and they won't enforce the few cases? We're just going to be back where we started from, it seems to me.
Okay, well, I don't want to get really wonky, but what has happened over the last 4 weeks is we've been able to stand up our surveillance systems. We're through the flu season, so we're able to use our respiratory disease surveillance systems that we used throughout the winter. And so now we have ready alerts available through emergency rooms and hospitals so that we can get early warning signals, which we didn't have in the middle of the flu season because you couldn't see the COVID infections underneath what we were having right then as a flu B outbreak. And so we now have sentinel surveillance systems up and running. And if you go to the CDC website, you can see them. So I have confidence in our surveillance systems, and matching that with our testing capacity. We can see states, if you go on the CDC site, that really have not had any respiratory or significant respiratory diseases and therefore don't have COVID-19 circulating.
Hello, Doctor. It's Megan. We talked about here at The View many times how African Americans are contracting and dying from this virus at higher numbers than anyone else. It's really hard for all of us to watch an entire population in the country get sicker and die than other populations. I have said that I think that we should be sending in medical care into different communities, possibly FEMA, who don't have the same access to health care that, say, The View hosts do. Do you agree with that? And what can you do to implement, more structure and more support for these communities that just don't have the same kind of access others do?
Well, I think it's a really great question, and I think we can see how this virus moves through populations, and particularly through metro populations, and particularly through vulnerable populations. We've seen that with disease after disease and pandemic after pandemic. There are always vulnerable groups in those pandemics, and this is a particularly vulnerable group. It's why very early on, I wanted everyone to know that what we were seeing overseas, even though it was very early, that if you had pre-existing conditions, you were at a particularly increased risk. And I want to really thank the millennials who really helped get that message out to protect their parents. And still, there's a lot of disease in our 20s, 30s, and 40-year-olds who have pre-existing conditions. And we have to, as a community, really ensure that healthcare is delivered there. It's why we've worked very closely with the public hospitals to make sure the public hospitals had the supplies that they need, because sometimes their supply chain is not as robust as some of the private hospitals. And I think you're absolutely right. Attention to these details will save more lives, and we're trying to really attend to each of those details city by city.